Good evening, everyone, and welcome to our panel discussion for tonight, which is part of the Syzygy Optimal Health series. My name is Ryan Fernandez. I'll be the facilitator for our guest doctors. But before we get to them and introduce them, I'm just so happy that you could join us tonight. I know for many of you, lung health and overall health is a very important issue, especially now that we're in a way transitioning out of that era of COVID. But anyway, if you're wondering what this is all about, the Syzygy Optimal Health series actually covers different topics about health, well-being, prevention, so that you could live at an elevated version or the best version of your health. Syzygy is our community. We believe in empowering people when it comes to their health, their personal growth, and even their finances. And we're a large community. We come from different backgrounds. But at the end of the day, we're very passionate about improving lives. So hopefully you'll be able to take something of value from our discussion tonight. I just want to share that we will be breaking down tonight into three parts. In part one, we'll have a discussion with our guest doctors. And then the second part, we're going to help cover some of your own personal questions. So you can use the chat box and type your questions as long as it's relevant to our topic tonight. We'll try to get them in, although we will have limited time as well. So you can put on those questions throughout the meeting, and we'll try to get through them. And in part three, we'll have breakout rooms. So these are smaller Zoom rooms where it's just you and maybe the friends who invited you. And it's purely optional, but you can join it and discuss more tonight's topic. We also have a health survey. So at the end of the meeting, you will be sent a survey. It's very quick, just a couple of questions. I'll also post the survey in our chat box, the link, and it would be a tremendous help to our event if you could take your time to answer that a bit. And in return, we'll also be able to help address some of your health concerns, which are very personal for you. So anyway, that's it. I'm very grateful once again to our guest doctors for tonight. Let me add the two of them. They're good friends of ours. We've had them speak before separately, but now they're together back to back. And this is your chance actually to take advantage of their available time and ask it straight from some of the experts. We have, first of all, we have Dr. Jonathan Arquiza. We call him Doc Onats. Doc Onats is a practicing pulmonologist. He is associated with several hospitals, used to teach in the Ateneo with St. Luke's and the Hospital ng Makati as well. We also have with us Dr. Ricco Santos, who is a practicing family medicine specialist based in Marikina. He is also a wellness practitioner and has helped many of our members in Syzygy actually either improve their health, reverse some lifestyle diseases, and even achieve their ideal weight. So we're very grateful for them to take this time out of their busy schedule to cover with us some of the things which really matter when it comes to lung health. Usapang baga tayo. So first off, thank you for joining us, Doc Onats, Doc Ricco. I hope you're doing well tonight, and I hope your families are likewise very healthy. Maybe just very quickly, in maybe 1 minute, could you tell us a bit more about what you do? Okay, Doc Onats, I'll start with you.
Yes, thank you very much, Ryan, for that kind intro. So I'm a pulmonologist. I hold clinics in Taguig and Muntinlupa, and I'm associated with one of the big hospitals in well, two of the big hospitals though in the city of Taguig, so both private and government hospitals. And I also still teach medical students from the Ateneo School of Medicine. So yeah,
Fantastic.
that's what I do.
Thank you so much, Doc Onats. Doc Rico, how about you? Just very quickly, can you tell us more about yourself and maybe your advocacy? Sorry, Doc, you're muted pa.
Thank you, Ryan, for the introduction. I'm Dr. Ricco Santos, practicing in Arquiza City. I used to be a company physician in a company in Taguig ng semiconductors. Since graduation, I've been handling patients of my father who was a pulmonologist. So I'm quite aware about the lung problems. And then later on, I transitioned into acupuncture, and much later, in 2008, into nutritional reversal of lifestyle diseases like type 2 diabetes, obesity, hypertension, etc. No? So I've been teaching mostly patients on how to do that.
Thanks, Doc Rico. And we're very happy that many more are joining us tonight. So we've got several questions, launching pad questions for our doctors tonight. Okay lang naman mag-Taglish tayo. But hopefully this will get everyone thinking, more informed, and also if you have any questions as well, you can use the chat box and we'll have our Q&A afterwards. So just to get us started, Doc Onats and Doc Rico, for both of you, what is the importance of pulmonary health? Let's start with you, Doc Onats.
That's a great question, Ryan. So what's the importance of pulmonary health? Now, this is the very reason my patients come to me. So first of all, when we talk about lung health, we talk about breathing, the capacity to breathe. So that's one. When we have difficulty of breathing, that limits our activities that we can do from our day to day. And we see this a lot in our patients that have not just lung problems, but have heart conditions as well, because this affects the lung, no, directly as well. And improving lung health will also improve the quality of life of our patients. So what else do we know? What the other things that we talk about when we look at lung health is the incidence of infections. No, and the most common cause of consultations usually in the clinic are the acute and chronic cough. And this is usually very, especially because of COVID, patients are now very much aware and nahihiya sila pagka nag-uubo sila. Diba? So addressing these problems helps not just their quality of life, but the quality of their relationships with their family and coworkers as well.
Yeah, that's very timely. And I think many of us can relate what you were just talking about with the moment medyo makati yung lalamunan natin, inuubo tayo. What are people going to think? And that includes our loved ones, the people near and dear to us. So absolutely on point, Doc Onats. Thank you. How about you, Doc Rico? As a family medicine practitioner, you encounter almost any kind of issue. For you, what is the importance of pulmonary health?
Actually, I cannot add any more to Doc Onat's description of pulmonary health. Kasi yan din ang mga na-encounter kong patient, especially in my early years of practice. Lung infection, upper respiratory infection, asthma, TB, COPD. So yung quality of life is impaired pagka hindi maganda yung kanilang status ng pulmonary function.
Yeah, so true, no? Uh, it it it's all very much connected with other uh concerns, no, other health concerns, and we'll dive into that in a bit. So moving on, since for both of you, pulmonary health is really front and center in almost many cases. Uh, in your careers, no, having encountered so many different kinds of patients, what are some of the common pulmonary conditions that you've seen? Uh, Doc Onats, let's begin with you because you're a pulmonologist. You practice in many different hospital settings.
Yeah. So I'll focus more on the outpatient settings. No, so what are the common conditions that we see in the clinics? No, very, very common now. Mga upper respiratory tract infections. The patient come in because of an acute cough, being productive, no, and very common now actually yung mga chronic cough, meaning these are patients that have cough for over a couple of weeks already, and they're not able to sleep, they're not able to function well, nahihiya sila when they travel, nahihiya sila pag nasa office sila, no, they have throat irritation, no, so mga upper respiratory tract infections, no, we have a lot of patients that are now being diagnosed with bronchial asthma, no, so it's becoming more common, especially siguro because of the need to travel, the pollution, no, and another common concern that patients come to me for is tuberculosis, no, findings of pulmonary TB on the X-ray and even findings of pneumonia. So ito yung mga common conditions that I very often see in the clinics.
Yeah, thank you so much, Doc Onats. It's very important that also I know you're a family man. Sometimes it's also in our home, in your home, your own kids,
Yes.
especially for some of us with children who go to school, uuwi yung bata, parang, teka lang, iba na yung kanyang pakiramdam, no? And it begins there. How about you, Doc Rico? What are the common lung-related concerns that you've encountered in your practice?
Actually, same with Doc Onats. Yan naman ang pinaka-common upper respiratory infection, no? Throat infection. No? Yun nga, yung mga long-standing cough na yun, no? Have been on antibiotics, hindi gumagaling, hindi mauulit na naman, no? Paulit-ulit, pabalik-balik, no? Yun ang nakikita ko yan, even young individuals, old ones, mga bata, matanda, mga long-standing cough, especially those na nagkaroon ng COVID before, no? Kasi meron na rin tinatawag ngayon ng long COVID, no? Ang nakikita ngayon yung persistent cough na paulit-ulit, no? Might be due to a hyperreactive response of the lungs to the particulates or the fragments of COVID na naiwan, no? Dun sa body, no? Dun sa lungs. No? Yan. TB din, yan. Asthma, allergy, allergies, very frequent din yan.
Yeah, that's so true. No, long COVID. I personally experienced that long after having quote unquote recovered. Hinihingal pa rin from time to time. Mm-mm. And others who I know of who've had COVID, whether it's severe or not so severe, minsan hinihingal pa rin. It's not 100% full recovery, as they say. But for Doc Onats.
Yeah, I'd like to just mention what Doc Rico said, no, because he mentioned not just chronic cough, prolonged cough, but he also mentioned recurrent cough. Ibig sabihin itong mga patients na to, parang gumaling na, tapos nagkaka-cough ulit, no, and they have this recurrent bouts of coughing, no, for several months, no. And we also see this very frequently now because the children are going to school face to face already. So parang maraming beses no, nagkakaroon ng mga health breaks ang schools no, pagka masyadong marami yung nagkakaroon ng ubo. So I often see some children, their parents bring their kids to me, no, because of persistent cough as well, no, na hindi mawala-wala or pabalik-balik.
Yeah, that's another factor, no? Many students are back to school, and that's where the exchange happens, where
That's
things
right.
get spread. Oh, how about, like, for example, this is a personal observation, and maybe some of our participants have noticed this as well. Itong December, January, even up to now, there seems to be this shared experience, the shared feeling of maraming inuubo, sinisipon. Is that just our imagination, or is that really, this time of the year talagang merong nauuso talaga ng mga ganyan?
Well, for me, no, it's really unexpected, no, an expected occurrence of coughing kasi because of the gathering. Diba? As you mentioned, no, kids get it from school, they bring it home. No, during the November, December when it's so stressful, no, then we also have our gatherings, and it's the adults now that are spreading, the viral infections, and we have a lot of different viral infections that are circulating right now. And siguro the other thing is, and I know Doc Rico would concur with me, is that poor diet during this time of the year as well. No, stress, poor diet, which would really predispose our us and of developing or becoming more susceptible to these viral infections.
That's another interesting you mentioned, Doc, no? The role of nutrition. And I think we'll be able to dive a little bit deeper on the importance of what we eat as well, and lifestyle, basically. So thanks for that. Moving on, we mentioned already a bit about how it spreads, but some people, they seem to be more prone to sickness. They take longer to recover. Others, not so much, but they're always quite fit. So let's start with you, Doc Rico. What are some of the risk factors associated with compromised or poor lung health para sa'yo?
Ah, pollution, air pollution, lalo na smoking, exposure to smoke, no? Cigarette smoke in particular, yung mga second-hand smoke. Actually, meron na rin tinatawag ngayon third-hand smoke, no? Yung naiiwan sa mga drapes, sa curtains, etc. No? Kahit wala na din yung smoker. Yan. Yung occupational risk din, mga masyadong plastic doon sa pinagtatrabahuhan nila. No? Doon sa lugar, merong construction. No? Yung frequent childhood infection. No? Yan. Mga risk factors for more serious pulmonary conditions.
What would you say, or what are your thoughts on, you have some people na early on, they already get all of these things. But you also have seniors who sometimes in their 80s still smoking and still parang hindi tinatablan. No?
Exception to the rule.
Oo, genetics ba yun?
I would agree. May genetic factor talaga.
Oo. Yeah. How about your thoughts ngayon na with the popularity of vaping and e-cigarettes? Is that really, well, just your personal thoughts? Are those things a better alternative?
Well, that's such a better alternative might not be really a good a good phrase to use for that. No, as a pulmonologist, as physicians, we're against the use of cigarettes and any smoking device, even the e-cigarettes. And very early on in, just very quickly, with regards to cigarettes, because it's really a major risk factor. And I guess because no mga vape and e-cigarettes are rising in popularity. Remember, it actually took decades for us to discover that cigarettes would actually cause no chronic and pulmonary conditions, no COPD, heart attacks, and cancer in particular. And for the e-cigarettes, some complications actually came out much earlier. No, it took less than 5 years for them to discover that there were actually complications that were related to vaping, especially among children who like to experiment on creating their own juices, for their cigarettes. So it's pretty scary actually, no, and it's really unregulated. It's not even regulated by our FDA.
Totally agree.
Yeah. Yeah, those are good points, no. And well, sometimes the consequences kasi they appear much, much later. But again, that's something also that we can count as a factor, no. Doc Onats, anything that you'd like to add in terms of risk factors?
Yeah. So it depends on the disease. We're going to talk about bronchial asthma. Obesity is definitely a risk factor aside from the environmental exposure to dust, smoke, no stress. If we're going to talk about lung diseases, infections, one of the major contributors is poor health because of diabetes. No, and we see patients with elevated blood sugar. If they come to me with a chronic cough and a chest X-ray showing very progressive or what we call cavitary tuberculosis, the chances that they have tuberculosis is actually that they have diabetes is actually very high. No, so diabetes is really something that needs to be addressed alongside the lung health as well.
Yeah. Well, for me personally, that comes as a surprise because pag naisip ko diabetes, iniisip ko blood sugar, hindi naman respiratory. And yet, here you are, you're telling us that may connection din sila.
That's right. No, and that's why sometimes you're also treating our patients' blood sugar level.
Compromise
Very
kasi ang
interesting.
kailangan immune system.
Mm-mm. And we know, of course, that in previous talks, Dr. Ricco then has spoken a lot about diabetes and its role actually in many other illnesses. And of course, Syndrome X, the collection of different symptoms or manifestations that, when put together, really, really threaten lives. So I think we kind of covered this a little bit na rin, in our different portion in an earlier. But sometimes it's not so obvious. Hindi naman palagi binabahing at inuubo ng yung mga pasyente niyo. Any other symptoms that for you are signs of compromised pulmonary health? How about you muna, Doc Ricco?
Coughing up blood, no? Yan. Kahit yung mga streaks lang. Yan. Sign of lung problem niya might be TB or pneumonia. Wheezing, asthmatic. Yung chest pain, yung parang mga lancinating pain, bigla na nagsasakit, no? Might be a sign of, especially kung sudden, no? Might be sign na nagkaroon ng lung collapse or pneumothorax. Kaya yung excessive mucus production, no? M lang M. Yan.
Yes, those are all, oo, mga kasama din yun, ano? Ehem ng ehem. Yung mga kilala kong ganyan. Magtataka no? Bakit ang minsan when I commute, napapansin ko rin, may mga tao talaga na malakas sila sa when they clear their throat, parang chronic siya, hindi matanggal yung irritation. Uh, how about for you, Doc Onats?
Yeah. Common symptoms, no, usually, and most important are recurrence, no, recurrence of symptoms, recurrence of cough, no, pagka yung pasyente makikita mo, alam mo gumaling na siya, tapos nakikita mo pagpasok pa lang ng clinic, nag-uubo na naman, no, the chronicity of cough, no, and usually when you look at these patients, no, may mga iba talagang payat, no, parang ang payat-payat na nila, no, they are weak looking, sometimes they have to come in on a wheelchair, no, kasi parang hinihingal sila. But of course, we see that a little bit more with elderly patients who have malnutrition. No? So basically, it's chronicity and recurrence of respiratory symptoms that usually point to poor health and the presence of shortness of breath, yung madali silang hingalin.
Agreed. Mm. When you say recurrence, Doc, no, how often should it be repeating to for someone to be concerned? Like, should it be happening multiple times a day, multiple times a week?
It's really more with yung gumaling na, tapos sometimes in a week, sometimes in a month or so, andyan na naman, same symptoms, no? And of course, no, having to, depending on the need of treatment, hindi naman pwedeng antibiotic ka ng antibiotic, no? We have to give steroids from time to time, no? Depending on the disease. And di rin naman pwedeng palagi nagbibigay ng mga systemic steroids. No, sometimes, no, when we say recurrence, pagka parang first and or second time, parang okay, maybe ano lang, no, nagkaroon lang ng kahawahan lang ulit. But a third time in a month or in several months, no, throughout the year, medyo ano na yon, no, that's really recurrent already. No, 3 times in a year is already a bit much.
Mm. Oh, that means there's something deeper at play. Hindi siya it wasn't completely solved. There's something else
Yeah.
that wasn't obvious in the beginning. Yeah. How about for children, for example? Siyempre, sometimes children cannot express or articulate yung kanilang discomfort. They're not so aware. Minsan, maligalig lang talaga sila. If you're a concerned parent, what could be the outward signs that you're looking for if you think that parang itong ubo or sipon ng anak ko, this is more than just the usual sniffles?
One is yung hindi tumataba. No? So those patients usually it's not so much yung coughing, no, related, no, lalo na very yung primary, no, primary complex. I think you might have heard of that term, no, for children with tuberculosis, no, hindi sila tumataba, no. Sometimes parents will mention that parang mabilis singalin yung anak ko, no, parang during sports they're not running as far, they stop more often, no. And of course yung parang kakagaling lang yan sa ubo, gumaling na nga, tapos ito na naman, no. So those are the common concerns that we hear from parents.
Okay, thank you so much. I think we have some parents then with us tonight, and food for thought. Oh, it's always better to understand and be prepared, no, and be aware. So thank you so much, Doc Onats, Doc Ricco. Let's move on naman, no? Siyempre, kailangan proactive tayo. Knowledge alone isn't enough. Understanding the signs, if you don't take action, what's the point? So, sa inyong palagay, no, ano ba yung mga helpful or mga important na mga check-ups to monitor lang yung lung health. So let's start with you again, Doc Onats.
Okay, so when we talk about regular checkup, it really depends on the conditions that we're monitoring. Very basic for everyone is at least to have a chest X-ray once a year. No, so that will allow us to have early detection of diseases like tuberculosis. No, kaya yung mga annual PEV, it's very, very useful kasi we can catch patients that have tuberculosis in the very early stages and limit the yung pagkakahawan nila sa iba. No, so definitely a chest X-ray. If you're working in a healthcare setting, then usually we recommend a chest X-ray at least twice a year. Pero once a year is usually enough for most. For diseases like bronchial asthma, so regular consultation with the doctor is very important. At least 3, maybe 4 times in a year. Because there are things that we monitor to make sure and to help you get your asthma under control. So same for patients with chronic obstructive pulmonary disease. Yung mga iba, mga diseases like pneumonia, it's really on an as needed. Hindi naman yan kailangan may routine checkups. So it's usually patients with chronic diseases that require regular checkup. If let's say you have history of significant smoking, then that would require at least a yearly checkup. Maybe a low dose CT scan might be in order to detect early findings of lung cancer. So it depends really on the condition that you're monitoring and the risk factors that the patients have. So walang standard except for the X-ray. Yun, definitely that's something we should get at least once a year.
Okay. Thank you for sharing all of that information. This is more of a personal question. For example, in our family, we have a history of asthma. My aunt, my father, myself included, we've all had asthma. And I have a newborn baby. Is there any test that can be done to find out if my child may have inherited asthma as well?
Well, baka si Doc Ricco I'm still thinking if kasi for children yan eh.
Or is it just waiting to see the signs? Doc Ricco, feel free to jump in then, no? And also add your own suggestions for checkups as well.
Yung sa asthma, I don't think there's any test to detect kung magkakaroon ng asthma ang isang bata. Kailangan lang very observant ng parent. No? Parent, and then pagka nagkakaroon ng wheezing, frequent allergies, that's the time na pwede ko na mag-suspect na may asthma yung bata. And I think one of the tool that we've used during the pandemic, yung pulse oximeter, malaking tulong yan during the height of COVID. Kasi nag-detect kung nag-impair na yung oxygen saturation ng lungs. Even though the patient is okay ang pakiramdam ko, pero yung chinek yung oxygen saturation, bumababa na pala. Kaya it's one of the tools to have na dapat sa bahay, yung pulse oximeter, especially to monitor your child or the elderly kung deteriorate yung kanilang lungs during a respiratory infection.
I guess, katulad ng sinabi ni Doc Ricco, you just have to wait.
Tama.
Diba? If it comes out, it will come out. Then you just have to be aware of what to look out for. If you have family history naman, at least you have an idea already.
And
be vigilant.
And that's talking from experience. I've been an asthmatic since childhood. So nawala siya nung medyo nagkaedad na ako. Nag-recur nung nasa medicine na po siguro dahil sa exposure sa mga chemicals sa hospital. And then, nag-recur after getting COVID. Nagiging paulit-ulit yung ating
Oh, na-trigger ulit
asthma
siya.
attack. Trigger siya ulit
Mm-mm.
yun. Especially
Mm-mm.
at night or early morning. Doon siya nag-trigger.
Okay. Okay. I read a question that's actually that touches on that as well now, but we'll go to those questions later on in our Q&A. But both of you, you've so far you've given some solid suggestions for the rest of us. Mainly be vigilant, understand, find out if it's in your history, be aware of the signs. But at the same time, we also have to be proactive. We can't just wait to get sick, diba? So when it comes to taking action naman, one of the things that I think it was Doc Onats who mentioned is to understand the value of good nutrition. And there are many ways that you can, of course, get good nutrition. Obviously, eat well, eat right. But at the same time, not all of us can do that constantly. If you live in the province, good for you. Baka you have better access to fresh food and all of that. Pero here in Manila, it's a different story. So we turn to the topic of supplementation to fill in that nutritional gap. So for you, Doc Onats, what's the role of supplementation and how can it help with lung health?
Yeah, that's actually a great question because patients always ask me, Doc, may vitamins ba para sa lung? Ayun ba, siguro si Doc Ricco, nakukuha mo rin ba yung tanong na yan? Doc, may vitamins. Ano ba ang pwede gawin para palakasin yung lungs? And the real answer to that is there's no specific supplement or food that will strengthen the other immunity to the lungs. It's really overall immunity that we talk about. So aside from eating healthy, and unfortunately, the diet and the quality of the food that's available, especially in the city, no, it's not the same quality. It's not as fresh, diba? And the nutrients are not as significant. That's why it's important for us to supplement. No, there are supplements that I recommend. So first of all, no, you want to make sure that you plug all the gaps in nutrition, you want to make sure that you get all of the vitamins and minerals. And what I usually recommend is this multivitamin, by Nutrilite called Double X, because it has a special addition to just not just vitamins and minerals. It also has the addition of phytonutrients, which cannot be replicated in a laboratory. It's only taken from plants, and it has shown to help reduce the risk of cancers, especially, and improve immunity. Then they have this new blend of supplements called iDefense. It has this holy basil and bioflavonoids, which helps to improve immunity. Vitamin C in the form of acerola cherry, and then there's also this part about improving protein. Like you asked earlier, ano ba yung nakikita sa mga pasyente na parang mahina yung baga? If they have low protein, low muscle mass. Those are patients also that have higher risk of infection. And maybe one last that I would recommend is to help control comorbid conditions. Let's say if you have asthma, you also have allergic rhinitis, then it's important to have the allergic rhinitis under control, because when one or the others, may asthma or allergic rhinitis, one or the other is in exacerbation na nag-attack siya, it sort of causes the risk of triggering the other. So one of the supplements that I found was this supplement called ClearGuard, which helps to control allergic rhinitis very fast. It's a natural alternative to the intranasal steroids and antihistamines that we use. So those are some of the basic supplements that I usually recommend.
Thanks, Doc Onats. Those are really some great recommendations. I'm curious, how about you, Doc Ricco? Anything that you'd like to add as well, and why you think important yun for someone to ward off, and improve their pulmonary health?
One of the mainstays that I give is the omega-3 supplements. No? Kasi anti-inflammatory siya. And I usually give it, especially kung maintenance, kung sa mga hinihika, may history ng hika, allergy, omega-3, pagka during the height of attack, pwede siyang increase up to 3 salt gels 3 times a day. Omega-3. Lahat ng mga nabanggit dito ko na sa eye defense, vitamin C. Vitamin C nga, I give it maintenance 1,000, 2,000 milligrams every day. Pag may sakit at respiratory infection, I increase it to 3,000, 6,000 milligrams per day. So that's several acerolas every day. Para na ang kinakain, parang candy. And another thing, freely available, the supplement is vitamin D3 from the sun. Very important on vitamin D3. It's been found through studies that very, very low vitamin D3 levels in the blood mas prone sila sa infection, and those infection becoming worse. No? Kaya nga nakikita yan sa mga nasa north or south, no? Mas increase ang incidence ng flu and even COVID during those times. And important yung sunlight. If you cannot be exposed to sunlight, supplement ka ng vitamin D3. Marami naman dyan. And it's a very cheap supplement. Vitamin D3.
That's an interesting addition, and thank you for sharing that, Doc Ricco. Kasi syempre in our modern life, many times we're just indoors. And I'm thinking right now of people who work yung mga graveyard shift. Marami yan, some of our healthcare practitioners, yung mga nasa call centers, baliktad yung oras nila. So they don't really get the same amount of sunlight as most of us do. So what you're saying is, of course, pwede magpa-araw. Matagal na yan na, kasabihan yan even ng mga matatanda, magpa-araw talaga. But also to supplement, because there are just many things that, of course, our body naturally produces, but many others that we need from foods and plants. And sometimes, though, those sources aren't of high quality. So it's important to find supplements that are made well, that have a good track record of quality. So before we jump into our Q&A and dumadami na yung mga questions natin, I'd like to thank Doc Ricco and Doc Onats for sharing their expertise, their time, and sharing some really important ideas with the rest of us. I'd also like to add that this event is brought to us by Syzygy, again, our community, as well as Nutrilite. Nutrilite is the world's oldest and largest brand of vitamins and supplements. So if you could just entertain us, or sorry, not entertain, but humor me for a bit, and let's learn a bit more about Nutrilite from these helpful and educational videos.
How do you prepare yourself to face the daily challenges? The energy you need to take on a new day, the vitality to keep yourself going, and the strength to overcome whatever that stands in your way. With Nutrilite Double X, of course, fortified with 11 vitamins, 10 minerals, and 19 plant concentrates, Nutrilite Double X keeps you in good health. Take on every day with a smile to keep you and your family healthy and happy.
The best defense comes naturally with respiratory and immune support from Nutrilite Immunity Defense, zinc, and holy basil. Made with holy basil, a sacred Ayurvedic herb, citrus bioflavonoids, and zinc, selenium, and copper to support a healthy immune system. with ingredients from plants grown on Nutrilite partner farms. Support your immune and respiratory health. Nutrilite. Plant, grow, thrive.
Hi there! I'm an acerola cherry, one of the main components of Nutrilite acerola C. I was harvested from the certified organic Nutrilite farm in Brazil, where they follow organic and sustainable farming practices to get the benefits of every produce. It is maintained and nurtured by farmers to have a good and healthy farm environment. So carefully chosen seeds of acerola cherries can be planted and grown. Amazing, isn't it? Acerola cherries are a good source of vitamin C. Each chewable tablet contains 67 milligrams of acerola concentrates, as well as citrus extracts that provide phytonutrient benefits. And as a bonus, it has a delicious cherry flavor. So that's me, Acerola C chewable tablet from Nutrilite.
Why take omega-3s? Take a closer look. The benefits are clear. Omega-3s are good for your heart and brain. In fact, omega-3s serve every cell in your body. They're like the premium oil that keeps your body fluid and flexible. But the challenge is, it's hard to get enough omega-3s from diet alone, and your body cannot produce essential omega-3s naturally. So, you need to supplement. Nutrilite Omega formulation provides 3 times greater absorption, helping your body better utilize the omega-3 fatty acids. Our 9-step purification process ensures only the purest and cleanest oil. We use sustainably sourced wild-caught fish, certified by Friend of the Sea. Then, combine it with traceable white chia seeds grown on our Nutrilite and partner farms. Easy on your stomach with a reduced fishy aftertaste, it's a complete source of omega-3s. Nutrilite Omega with 3 times greater absorption. Nutrilite. Plant, grow, thrive.
Okay, so I hope we all learned a little bit more about Nutrilite and some of the recommendations of our guest doctors for tonight. O sige, we are now opening the floor to some questions. Kanina pa, there were some who were very curious about the topic. So let me just read very quickly the question, and I'll let both Doc Onats and Doc Ricco reply, whatever you feel like saying, no? This first question comes from Titus Manuel. He asks, is it true that pulmonary-related attacks happen more at night rather than daytime? I recall someone mentioned this na kanina, but is there any truth to that?
Yeah, well, I know where Titus is coming from, no, with this question, but it's really more related to asthma. No, so it's really no when we consider asthma, we always ask about nighttime worsening. So when we have patients that have worsening cough or shortness of breath that happens at night, no, the consideration of asthma actually becomes higher than other considerations. No, but it's not with other diseases like pneumonia, upper respiratory tract infection, it's not necessarily true. No, so it's more related to bronchial asthma, yung nighttime worsening.
Okay, thanks for that. Doc Ricco, anything you want to add?
Yeah, I agree. Tsaka sa teaching din ng acupuncture and traditional Chinese medicine, the lung meridian is actually more active during those times, no? Mga 1 to 3 o'clock, no? Kaya siguro doon nagiging more pronounced yung mga asthmatic symptoms. Pero other diseases wala na. Sa asthma lang yung allergy.
Okay. Yeah, thanks, Titus. Hopefully, you find that reassuring. Okay, this next question comes from Olivia. She asks, please confirm, once a child has asthma, do they have it for life? Okay, so this is an asthma question again.
And si Doc Ricco, sabi niya asthmatic siya nung bata siya eh.
Yeah, I was asthmatic. Ngayon, dahil din sa nagkaroon ng COVID, nagka-COVID ako, actually nawala na eh, totally nawala. Kasi kasi sawa ako sa sa mga anti-asthma na drugs, even steroid, no? Inhaled steroids, no? So, at saka nagkaroon ako ng skin asthma na very, very worse, no? So, wala akong makitang solution sa mainstream medicine. So, napag-aralan ko yung acupuncture. I tried acupuncture on myself. No? Nung una, nagpapagamot lang ako. Later on, pinag-aaralan ko na yung acupuncture. No? And then, I applied it to patients. No? So, nung natuto ko ng acupuncture, I found out na yung mga severe asthmatic na hindi na halos nagre-respond immediately dun sa mga inhaled steroids or bronchodilators, pagka nag-acupuncture sila, mas responsive sila actually. And actually, I even treated COPD patients, no, with acupuncture, na wean off from asthmatic drugs. No? So, meron talaga nagtitrigger para mag-recur ulit. Pero kung hindi naman na-trigger yon, it doesn't have to be a lifetime condition.
I'll give my take lang, no, of what literature says. No, that usually, asthma in children can be outgrown at around the age of 10. Ibig sabihin, childhood asthma, no, after 10 years old, parang biglang wala siya. Unfortunately, it can recur. No, there are patients na hindi na talaga nag-recur throughout their life. So that's very fortunate for them. No, but a history of bronchial asthma, childhood asthma for us is quite significant kasi that tells us, no, like sabi nga ni Doc Ricco, so kanya bumalik nung after COVID. And my personal observation is that patients that have had COVID or other viral infections, parang nabuhay ulit yung asthma nila that they had in childhood. So it's not necessary that you will have it throughout your life. You can outgrow it by the age of 10, but it can recur, if with the appropriate triggers.
Okay, thank you, doctors. No, so we're also debunking, myth busting. So thank you. This next question comes from Matet Ricco, who is based in Legazpi, Albay. With the present situation in our area, Mayon volcano is spewing ash again. Oh no. What's the best prevention we can make?
Environmental kasi yan eh. So,
it's not like you can stop the eruption.
yeah, you have to wear a mask. No, that's for sure. That's primary. No, and supplementing, maybe you can up titrate other supplements. No, kasi definitely exposure to VOG, diba? Volcanic, volcanic gases yan. It will increase or will affect your immunity. So, but of course, the prevention is key. Ako wearing a properly fitted, yung mga KN95 masks might be more appropriate in these cases.
Yeah, I think since COVID, we've all become more appreciative and aware of the importance of wearing masks. But again, thank you for answering that. She has a follow-up question as well. If there's a recurrence of colds and cough after medication, can that be an allergy?
Definitely. No, kasi when you look at cough and colds, we don't only consider infection right away. No, let's say if it's dry, kung dry cough, mas more likely to be allergic in nature. If it's productive, then it's more likely to be it's more commonly related to viral infections. No, yung characteristic ng sipon tsaka phlegm will also give us an idea of what the cause might be. But definitely we always look out for allergens. No, ito sad to say, sometimes it's pets. So that's also one of the things that I ask, kung may pets pa kayo sa bahay, I discourage the, if you have parang symptoms of allergies na wag na lang sa bedroom. No, so some ano lang, no, vacuuming, etc. can help with that. So just some considerations, and especially if there is renovations in the house. So yung mga common na tinatanong ko. Kasi in-house renovations, unfortunately, you're living amongst the construction. Eh. No? So very common ano rin, no? Very common cause of coughing as well.
Yeah, those are all practical tips. Thanks, Doc. Those are all the signs. This is a question from Mocha Rayala. Can you take ClearGuard for long periods of time? Like quote unquote maintenance supplement.
Yeah. Okay, kasi I brought this up. No? For ClearGuard, usually, even for allergic rhinitis, it's usually seasonal. So you do want to take note of when the season of your allergic rhinitis comes out. No? And it can be used siguro as needed, no? Parang as an antihistamine. But for we don't usually, I haven't recommended it long term kasi even for no for patients taking intranasal steroids, hindi naman sila naka-maintain on this. No, we just keep them on it for about 3-4 months max, no, during the season when their allergic rhinitis is triggered.
Yeah, thank you. How about you, Doc Ricco? Anything you want to share on that?
Yeah, hindi na kailangang lifetime na iti-take yung mga supplements or drugs for the allergy or what. Pag nag-improve na, 2 and 3 months, okay, we stop. And then you can resume it again later on during the season of flu, kung taglamig, o kaya mayroong construction malapit sa inyo, di tsaka mag-take ng mga supplements for allergy.
Okay, noted. Thanks again. This next question comes from Dr. Net Soltura. She says, is lung scarring due to COVID reversible? Based on my spirometer, I can only inhale a range of 750 to 1200 ml when the normal should be about 4 liters. So may discrepancy na. Doc Ricco, Doc Onats, your thoughts on this?
Well, early on in when the COVID pandemic was on the rise, especially in the beginning, COVID fibrosis was a real problem. And because of the acuteness of the illness, wala pa talaga tayong data no, on what the chronic course was going to be like. No, but years later, 2-3 years later, we actually found patients that nare-reverse yung pulmonary fibrosis na yon. So that's actually quite fortunate. No? That's why we don't have as many patients as we would have expected to have long COVID. Meron, oo, but siguro kasi may mga predisposing comorbidities din sila. But we actually see a reversal no, on a lot of patients. And so, yun, it can actually improve no, rehab, pulmonary rehab especially can improve no, yung condition of the lung. So it's really a matter of no judicious exercise, lung exercises, yung spirometer that can help improve on that.
Thank you so much. Doc Ricco, I know you've spoken before about the importance of breathing exercises in various forms, okay? How about you? Do you think any of those exercises could be helpful as well for anyone who's recovering from or who has fibrosis from COVID?
Yeah, definitely. No? Ang important dyan kasi sa breathing, dapat you breathe through the nose, not through the mouth. No? Kasi ang nose, filter out yan yung mga particulate matter, and it actually humidifies and make the air that comes in more appropriate sa body temperature natin. Very importante yung breathing exercises, and it can actually improve your lung function din. Ng breathing exercises, aside from being calming to the immune system, lalo na yung yoga breathing exercises. It calms the immune system. Meron siyang parasympathetic effect. Yeah. it really helps na breathing exercises. There's actually a breathing method na matanda yung pangalan that they recommend, no, to improve sa mga asthmatics. Matanda yung pangalan ng method. Very popular. Pero it escapes my, my memory.
Well, if you recall the breathing method, please share it in. You could message me actually, and I'll share it through our messenger chat group for anyone who's interested.
Ito isang naalala ko, no? Yung breathing nga pala, no? Especially sa yung mga tinuturo sa yoga. During breathing through the nose, no? And humming, you actually increase nitric oxide release sa nostrils natin, no? Which helps as an anti-pathogen sa ating nose, no? Yung humming, breathing with humming exercises. It actually helps release nitric oxide. It's a very powerful anti-pathogen. It also helps dilate blood vessels. Doon din importante ang sunlight actually. Dahil sa nitric oxide. Nitric oxide is actually produced din sa skin aside from vitamin D3. And even melatonin, most of the melatonin produced by our body, 95% is actually produced in the skin mitochondria. Sa pineal gland is around 5% lang produce ng melatonin. Kaya lang tayo hindi naantok because it's not released through the bloodstream. Nasa mitochondria lang. So, kaya important ang sunlight exposure. D3, melatonin, and nitric oxide.
Very interesting. In fact, we could have a whole different topic on that naman, no? Maybe a follow-up practical application naman on breathing exercises and other supplements. One last question for Doc Onats, and then we're gonna wrap it up. And after this, please join us for our breakout room. So hindi pa tapos, but we're gonna send you off to different smaller rooms where you can discuss and maybe chat more about your health concerns. This one is still about asthma. If the child continues to experience allergic colds and cough beyond 10 years old, should we expect this to be a quote-unquote for life condition?
Yeah, so thank you for that question. So I should have clarified this, and I'll also follow up with a comment about dogs. So kasi I don't want to leave you hanging naman. So for children, yes, unfortunately, if you pass the age of 10, 12 years old and may asthma pa rin, no, it's usually going to be a chronic condition. No, kasi hindi na niya na-outgrow. No? That's the actual term that textbooks use. So tuloy-tuloy na yon. And then I just have to comment about the dogs. It doesn't mean you have to get rid of the dogs, okay? It's just that if you have persistent coughing that seems to be triggered around them, then that might be they might be the cause. So yun lang naman, hindi naman ibig sabihin na kung may asthma hindi na pwede magkaroon ng PEPs. So it depends if they're reacting to it or not.
Thank you. Once again, Doc Onats, Doc Ricco, maraming salamat. We are so grateful for your time and for your expertise. We learned so much today, and hopefully for many of our attendees tonight, we'll be able to walk away with richer with that knowledge and to be able to take care of our families, our loved ones, and ourselves